Hey there. You ever see one of those ridiculously long medical words and your brain just checks out? Yeah, we've all been there. But here's the thing. What if I told you those words aren't actually meant to be scary? They're more like simple puzzles. Puzzles just waiting for you to solve them.
I'm talking about words like these: gastroesophageal, pyelonephritis. I mean, come on, they look like they're from a completely different language, right? So whether you're powering through your grade 11 bio class somewhere in Ontario, or maybe you've got your sights set on U of T or McMaster for med school, seeing a word like that can feel like running straight into a brick wall. Well, guess what? That feeling, it ends today.
That's exactly right. Every single one of those complicated-looking words, it's a code, just a set of clues that tells you a little story about the human body. And today, you and we're going to become code breakers. Let's get started.
All right, let's jump right in. Any good code breaker needs a toolkit, right? You need your set of keys to unlock all the secrets. So that's what we're going to do right now. We're going to build our own terminology toolkit. And trust me, it is way simpler than you might think.
So, pretty much every medical term you'll ever see is built from just 3 kinds of pieces. Seriously, just 3. Think of them like Lego blocks. You've got a prefix, that's the beginning, a combining form, that's the middle, the core subject, and a suffix, the ending. Once you know what a few of the blocks mean, you can literally build or break down almost anything.
Okay, first block, the prefix. This is that little piece right at the front of the word. Its whole job is to give you context. It's a modifier. It tells you stuff like how much or where, or maybe is something there or not. You already know this, right? Like pre in the word preview just means before.
So let's load up our toolkit with a few of the big ones. For example, you've totally heard someone being called hyperactive, right? Well, that hyper part means too much or excessive. The opposite of that is hypo, which means too little or deficient. Oh, and if you ever see dis, that's like a big red flag for something being bad, painful, or difficult. Just knowing these few, you've already unlocked so much meaning.
Okay, let's jump all the way to the end of the word now. Let's talk about the suffix. You could almost think of this part as the action hero of the term. Why? Because it tells you what's actually happening. Is a body part inflamed? Is something being surgically removed? Is a doctor taking a peek inside? The suffix, it spills all the secrets.
And here are some of the most common suffixes you're going to see over and over again. If a word ends in itis, I want you to immediately think inflammation. You know, something's red, angry, swollen. See the ending ectomy? That means something is being surgically removed, just gone. And scopy? That's a visual examination, like when they use a tiny camera to look inside the body. See? The suffix is absolutely the key to understanding what's going on.
Okay, our toolkit is officially assembled, so let's put these new skills to the test. It's time for our first case file, the gastrointestinal system. You know, the digestive system. Time to see what we can do.
I want you to think of this diagram as our treasure map. Every single term we're about to crack is basically a location on this blueprint of the digestive system. We're just going to follow the path of food, right from the top all the way down. Let's start tracing.
So let's start at the very top, the combining form. Now remember, that's our core subject, the main part. For the esophagus is esophago, and for the stomach, it's gastro. So from now on, anytime you see gastro, your brain should just immediately light up and picture the stomach on that map. Now, the digestive system doesn't do all the work by itself. It's got this vital support crew, these accessory organs. So the code for the liver? Hepito. The gallbladder is cholecysto. And the pancreas? You can probably guess this one. It's pancreato. See, a lot of these are pretty straightforward.
Okay, but what about all those long winding tubes? Well, the code word for the intestines, and we're usually talking about the small intestine here, is entero/O. Go ahead and find that on your map. That's where a huge chunk of digestion takes place.
Awesome work on that first case file. You are really getting the hang of this. So let's level up. It's time to see how all this knowledge builds as we move on to unlock the codes of the urinary system.
And here is our new blueprint. The whole deal with the urinary system is filtering waste out of the blood and then getting rid of it. So we're going to start up at the kidneys, follow the tubes down to the bladder, and then trace that final exit path.
Okay, now here's a fun little curveball for you. The kidney, it actually has 2 different very common code words, nephro and reno, and they both just mean kidney. Yep, it's just one of those little quirks you file away in your code book. Don't worry, both are totally correct.
All right, let's follow that path down from the kidneys. First, you've got the ureters. Those are the little tubes, and their code is uretero.
They lead down to the bladder, which is kind of like the system's holding tank, and that has the code cysto. And finally, the exit tube itself is the urethra, or urethro.
All right, codebreaker. You have the tools, you've seen them in action, so now it's your turn. This is the final challenge. And you're not just going to be analyzing words this time. Nope, you're going to build them.
Challenge number 1. Imagine you see this word on a patient's chart. Hepatitis. Based on what you've just learned, what do you think it means? Go on, take a second. I know you've got this.
Okay, let's break it down together. That combining form, hepato, what does that mean? Liver. And the suffix itis? That means inflammation. So you put them together and what do you get? Hepatitis is, quite simply, inflammation of the liver. See? You totally cracked it.
Okay, you ready for the final boss level? Let's flip this around. Let's say a patient needs the surgical removal of the stomach. How would you write that as a single medical term? Think back to your building blocks.
All right, let's build this thing. What's the code for stomach? It's gastro/O. And what's the code for surgical removal? It's -ectomy. You combine those two blocks and you get a gastrectomy. Perfect. This just shows that you can now basically speak this language forwards and backwards.
So that's the main thing to remember. This whole thing, it isn't about memorizing a million random words. It's about learning a system of clues. And you now have the keys to decode it. You've learned how to read the code.
You've just proven you can crack the codes of the terms we use right now. And it really makes you wonder, doesn't it? I mean, medicine is always advancing. There are always new procedures, new discoveries, and they're all going to need new names. So what amazing terms will you, the next generation of thinkers and healers, help create? The code is officially in your hands now. Thanks so much for cracking it with me today.